Assalamu alaikum. Good day, everyone. My name is Abdul Rauf Ali Al-Manama from the Islamic University of Gaza. Today, I will briefly highlight the antimicrobial resistance situation in the Gaza Strip during the ongoing war, its major drivers, the impact on vulnerable populations, and what is currently being done to mitigate this growing threat. Gaza is facing one of the most severe humanitarian crises in its history. Large parts of the health system are either damaged or completely non-functional. Massive displacement has forced over 1 million people into overcrowded shelters, creating ideal conditions for infectious diseases transmission. At the same time, damage to infrastructure, water, sanitation, electricity has weakened all health services. This fragility significantly increases both infection risks and the overall burden on the already overstretched health systems. With regard to the AMR burden and drivers, one can say that AMR has been rising sharply during this conflict. The major driver is the overuse of antibiotics, mainly due to the lack or absence of diagnostic capacities. Laboratories were destroyed. Supplies are in shortage. Clinicians often have no choice but to use broad-spectrum antibiotic empirically, thus increasing the chances of emerging resistant strains. Second, the shortage and inconsistent availability of quality antibiotic pushes patients towards self-medication or substandard drugs. Third, the nature of water-related wounds, the war-related wounds, crashes, injuries, burns, and contaminations from rubbles creates a high risk of infection with resistant bacteria. In addition, environmental contamination, including sewage leaks and debris, further spread resistant organisms. Finally, the supply chain interruption have left the facilities dependent on whatever antibiotic are available, often not the optimal use or not the optimal ones. These AMR trends were already seen before, for example, during the Great March of Return during the 2018-2019, as highlighted in our published study in the Lancet conference. There are many challenges in infection prevention control, labs, and medicines. One of the biggest challenges is the severe shortage of personal protective equipment, disinfectant, and even clean water, making proper infection prevention and control extremely difficult. Most laboratories have limited functionality due to damaged electricity, shortage, and lack of culture material. Surveillance systems that normally track outbreaks and resistance patterns have also been disrupted. Essential antibiotics, including first-line agents, are in acute shortage, leading to increased reliance on broad-spectrum antibiotics, as mentioned earlier. Additionally, overcrowded shelters makes outbreak infection control challenging and increase the spread of resistant organisms across families and communities. With regard to the vulnerable population, I think all the population in Gaza during the 2 years of destruction are vulnerable population. However, there are special groups such as children who faced high displacement, sometimes more than 15 times in some families, malnutrition, interrupted vaccination programs, increases infection severity and exposure to antibiotics. Also, the elderly and chronically ill patients with diabetic or high blood have lost their ability to access their medication, thus their situation may deteriorate and maybe become susceptible more to infection. Also, wounded individuals, especially from war-related wounds, which are multiple and very severe, usually suffer from infection, and these are vulnerable group Pregnant women and postpartum women faces also increased obstetric infection due to limited aseptic conditions in hospitals. Lastly, the immunocompromised, and I'm assuring you that most of the population are now immunocompromised due to poor nutrition and stress due to forced displacement and the man-made famine during especially the last 6 months before the ceasefire. However, despite the fact that the Israeli aggression has affected and targeted the health sector, most of hospitals were bombed, clinics, storage houses, ambulances. Yet there are many great efforts has been done by the Minister of Health, although not enough, but there have been some efforts. Currently, there are uh, uh, some efforts, some attempts to restore basic laboratory diagnostics, especially bacterial cultures and rapid tests. There are trials to, attempts also to partnership with NGOs and UN agencies, which are helping in infection control. Health authorities are also working on outbreak response, doing some plans. For instance, currently they are doing a cholera national control plan. Finally, emergency vaccination program like the one which was done for poliomyelitis last year. In conclusion, urgent support really is needed to prevent AMR deterioration. We have to strengthen lab capacities, infection control and prevention capacities also, medicine supply, water and sanitation, and I emphasize on the water and sanitation because of the very importance of these factors in preventing infectious diseases, thus limiting the need for antibiotic, thus limiting the emergence and spread of antimicrobial resistant strains. Also, we have to invest in sustainable AMR surveillance, and coordinate international actions can stabilize the health system. Thank you.